when I joined HESVIC, I was very new to the qualitative research. I'm from a quantitative background. I had no clue what is qualitative research, but then it's a long journey, very fruitful, very productive. For me, research was always in numbers, proportions, confidence intervals, which never answered the why aspect of the problem. Here I learned to dig into the problem and ask why, not only what, why and how. I think the skill, I would be using it in my future. Now I can comfortably and confidently say that, no, I know qualitative research.
Because besides knowledge and skills, I think I've got a lot of more things like to broaden my professional network, not only with my international colleagues within the project, but also with people that I met during the data collection and working with people in the system in my country, like policymakers and people at the local levels, health managers and health service users, and I think I've gained a lot from them.
And also in terms of research, it helps me a lot with my teaching and also supervising skills, because I will have take that knowledge to do the training, because I'm in charge of qualitative research methods teaching at the school, and also helping me with supervising students who are involved in policy, but also qualitative research. And
we learned a lot in terms of the concepts of governance and stewardship, and how regulations work or do not work in our country, and how each of those small aspects affect the health services directly and indirectly. So it was tremendous learning experience for us and also our team, because I don't think there are many people working on governance in the health sector. So for a lot of us, it was a big learning experience.
And men's expertise and I gained from this project is a policy analysis in maternal health area. We have very much involved in Vietnam.
So I think one thing is the coordination, and also how to management the project. I think we learned a lot, not only at the administrative part, like start from very small things. We know how to take minutes. To I think more complicated is multidisciplinary. Which kind of mechanism, which kind of approach we should apply, then we can work together.
From a scientific viewpoint, I would say that what has been nice was the necessary multidisciplinary combination of methods to be used to achieve the project goal. In fact, we could not be limited to social sciences or to public health or to medicine or to epidemiology or to political sciences or to economics. We had to find our own blend of methods, because it's a unique problem and it's subject to be understood and described to a unique combination of methods.
So other highlights were opportunities, particularly at later stages of the project, to generate something that is useful to strengthen health systems in the 3 study countries, but also generate something that is generally applicable to not only Vietnam, India, China, but various other countries within the region and wider, such as dissemination of knowledge in various conferences, various presentations that we made at our own institutions, but also presentations that the study country teams made at the national level, spreading the lessons learned into policy and practice. And those were quite remarkable events that I would imagine.
And it's increasingly obvious as we have finalized the research analysis that we've got a much better understanding of how regulation and the processes behind them, how they work, and probably more importantly how they don't work, and where the problems are in terms of governance around regulation. It's been hugely pleasant, gratifying to see particularly some of the younger researchers for whom this sort of area of policy analysis is new, to see them grow during this period, to see the sorts of insights that they're now coming out with in the research, and to know that in 5, 10, 15 years' time they will be leaders in their fields. So that, I would say, is possibly as important as the specific research outputs, that growth in capacity.
Project has been set a very big aim and a lot of research objective. I think we try very much to achieve the research question or objective. But however, the one thing very much concerned is the equitable access care, that how is the relationship, governance and equitable. We answer this, but because of due to limitation of some methodology issue, we cannot answer fully this question. But we hope that in the future, when we have the opportunity, then we can continue to explore this.
I would say, because I don't have very much social science background, and so when I do this kind of research, a lot of ideas was in my head. And if you control this is good, but that one will bad, and that one will good, so it's all linked. And all of these ideas are in my brain to fight each other. I think I don't know how to smooth them.
I would not say that expectations, but something I realized during the course of research, that maybe we could have had more scope in terms of interactions with the VIC countries, Vietnam, India and China, during the whole research process amongst ourselves, to reflect and learn from each other a little more than what we could do. Yeah.
There were expectations that were not met, but or rather partly met and partly not met. We had hoped to push the boundaries of interdisciplinarity. I think we achieved some of that, but not sufficiently. And I don't regret it, but it was an expectation to do much more. But all projects are time-bound, and things can't be achieved within those timelines.
Other challenge I learned from this is, six countries coming together with their own agenda, and in a multi-country research, how difficult it is, how challenging it is to accommodate each one's agenda. It really broadened my perspective. And I think I'm more open to the ideas now than before.
You see, some problem put forward by our partners whenever they come from, sometimes I feel surprised, because to my mind, it's just the case, just the situation. Why do they have this kind of problem? You know, our Chinese, we used to just accept something, accept ideas. Our teacher told us, our leader told us, we seldom to ask questions. Yeah, we used to because we taught in that way since we were very young. Yeah, so this project I need to, I think I start to think why and the how. Yes,
the main highlights of the this particular multinational team and the functioning of the project were on different levels. Obviously, the different project milestones, such as project meetings, were a great opportunity to boost the morale, to inject the energy and to catalyze quite a lot of almost like outbursts of activity in one of the policy theories throughout the project life. And that was enjoyable on both professional as well as the social grounds. But it was also a great opportunity to strengthen and deepen the partnership relationships between the individuals as well as the organizations.
I think the things that I've learned is that is the most clear is to like how to communicate with people from different backgrounds, both in terms of knowledge of professionalism, but also from cultural backgrounds. And I felt that through working with the teams, I think my confidence increased.
The larger international team, it was a multidisciplinary team, and it was an international team, and this has several advantages in terms of the study object, because we see the limitations of our conclusions in the way that they are constrained by an environment which is variable across India, China and Vietnam. So this helps to better determine the domain of validity of our conclusions. And also it's interesting because in fact it sort of provides a different, not only disciplines, but I would say also cultures and traditions in the research teams, and that's also something which is very nice.
So you come together as a huge potpourri of people with a sort of maelstrom of ideas and backgrounds. And that's a strength and a challenge. And the strength is that there's the potential for huge complementarity, there's potential for cross-learning, there's the potential for insights that single disciplines and single focus studies will never achieve. So, and I think we have gained from that multi-country and multi-partner partnership. But it brings challenges. And within a limited period of any project of this sort, some of those differences lead to tensions, lead to academic discussions, sometimes amicable, sometimes less amicable, as we try and find a way through a compromise and hopefully new methodologies that grow out of that, if you like, dialectic. So, yes, there are huge positives, at times there are huge frustrations, and some of those are perhaps more obvious to me as a coordinator than to others. But in the end, it is worth it. In the end, those strengths outweigh those challenges, and for anybody watching this who hasn't been involved in one, get involved in one. They're worth it, despite some of the pain that goes with it. I guess I perhaps want to say thank you to the team, and particularly to the team within Vietnam, India and China, all of whom have put huge energy into the research, huge enthusiasm, and whom I think I referred in a sense partly to this earlier, but who have used this as an opportunity to enhance their health system, have worked with policymakers, and I see this in all three countries, the PIs and their colleagues working alongside policymakers, trying to make changes for the better in the health system. And that's great to see. This is not academic research for the sake of academic research. This is research to make a difference. And these are the people who will, in the end, make a difference. And I've enjoyed seeing that.
Thank you.
Thank you.